Cognitive Behavioural Therapy, or CBT, Part 2. Cognitive behavioral therapy is a well-established and effective psychological approach for managing anxiety. CBT focuses on identifying and changing negative thought patterns and behaviors that contribute to anxiety. Here are some more common cognitive distortions that contribute to anxiety and how we can apply CBT principles to help reframe these negative thought patterns for anxiety belief. Filtering or selective abstraction. The cognitive distortion here is to focus solely on the negative aspects of a situation while ignoring the positive elements. An example would be to think, I received positive feedback on my project, but because I made one small mistake, I'm a failure. The strategy is to challenge filtering by consciously acknowledging the positive aspects of your performance. Consider the overall success of the project and the constructive feedback received. Personalization. The cognitive distortion here is to take personal responsibility for events that are outside your control, or attributing negative outcomes solely to yourself. An example is to think, my friend cancelled plans. It must be because I'm boring and no one wants to be around me. The strategy would be to recognize when you are unfairly blaming yourself by considering other factors, such as your friend's schedule or commitments. Avoid automatically attributing negative outcomes solely to yourself. Should statements. Here, the distortion is to impose unrealistic or rigid rules on yourself or others, leading to feelings of guilt and inadequacy. An example is to think, I should always be able to handle everything perfectly. If not, I'm a failure. The strategy is to challenge such should statements by asking, is it realistic and fair to expect perfection? Replace rigid expectations with more flexible and compassionate language, such as, I would prefer to do well, but it's okay not to be perfect. Emotional reasoning. Here, the distortion is believing that because you feel a certain way, it must be true. An example is to think, I feel anxious about how the presentation went, so it must have been a terrible presentation. The strategy is to separate your feelings from facts by acknowledging the anxiety, but evaluating the scenario objectively. Consider whether there is any actual evidence supporting the idea that the situation is terrible. Labeling and mislabeling. Here, the cognitive distortion is attaching negative labels to yourself or others based on behavior or events. An example is to think, I made a mistake in my presentation. I'm such a loser. So the strategy is to challenge such extreme labels and avoid defining your identity and self-worth based on isolated events. Instead of labeling yourself negatively, acknowledge the mistake and recognize it as a single event or outcome rather than a defining characteristic.